Elevate is a game changer on so many levels. And tonight we're going to deep dive into the benefits and share some experiences. So next slide, please. We'll start by talking about tesofensine. So tesofensine is it's going to improve your neurotransmitter signaling, and it is a monoamine reuptake inhibitor. The first time I heard that, I'm like, it's a what? Our neurons communicate through chemical messengers called neurotransmitters. And specifically, there are three that are very important when it comes to appetite and motivation and drive. And those three are dopamine, serotonin, and norepinephrine. And what tesofensine does, it makes the signal before the originating cell takes it back up again, right? Sends the message and then takes it back up. It makes it last longer and be stronger.
A lot of the prescription drugs can do that selectively. So with tesofensine, we're getting dopamine, serotonin, norepinephrine. And the neat thing about that is oftentimes if you're taking prescription medications that just do one thing, like for instance, serotonin increasing prescription drugs, those would be fluoxetine, which is Prozac, sertraline, which is Zoloft, escitalopram, which is Lexapro. These are some of the more common antidepressants that we use in clinical practice. So if you're on any of those, it does help to raise serotonin levels, which make you feel good. On the downside, though, a lot of people then start to notice that they get fatigue, or they might notice that they're eating a little bit more, they gain weight. That seems to be the big problem with just serotonin alone, prescription drugs, or they notice that they have lack of sex drive, their libido goes down. So the beautiful thing about tesofensine is that you're getting the upregulation of norepinephrine, dopamine, so that we're not seeing the weight gain, we're seeing the weight loss, we're not seeing as much of the fatigue. You're getting, a lot of people have mentioned to me that their energy is better, their focus is better. So it's just kind of rebalancing your neurotransmitters if they've been, for whatever reason, stress, lack of exercise, a lot of chronic pain. There's a lot of reasons why people might get kicked out of balance with their neurotransmitters. So it just helps to upregulate things. And we talk about the reason why it's important to maybe cycle off. And it's just going to be because if your receptors are so used to getting more serotonin, norepinephrine, dopamine, what'll happen, your body's so smart, what'll happen is it will downregulate production of those neurotransmitters. So even if you are trying to get more, because you're not making as much, the tesofensine may just feel like, if you're on it for too long, may feel like it's not working as well. So
Super. Yeah, super important to keep it fresh and not to get that fatigue, neurotransmitter fatigue. And I think one of the things, Dr. Lynn, that people have been so surprised by is how deeply they're sleeping also. And talk a little bit about dihexa. So this is a really, really special compound. It supports memory and learning, mental clarity. It literally supports the brain's ability to adapt and to form new neural connections. It can even help support creating new neurons. And so the ability to have organized thinking, being able to stay focused and on task.
As we get older, we get set in our patterns. Different lobes of the brain, they only communicate a certain way. And so with dihexa, you're upregulating your ability for different parts of the brain, for different brain cells to start communicating with each other. So dihexa, not only is it allowing you to grow more brain cells, it's allowing those connections, synaptogenesis between the brain cells. The nice thing is that it also may reduce inflammation within the brain. And so the thing that we all worry about is Alzheimer's dementia. And with dementia, that type of dementia, there are inflammatory plaque that builds up. And so it may help to reduce plaque formation, reducing your risk potentially of Alzheimer's dementia. If you already have the plaque there, unfortunately, it's not going to break down the plaque, but If you have plaque there where the brain cells cannot communicate with each other, you can rewire those connections. So people, even if they're starting to notice some memory issues, early dementia, it is still possible to kind of reverse that.
When we think of tesofensine, I like to think of the word clarity. When we think of dihexa, I like to think of capacity. And then this next ingredient, BPC 157, it just supports rapid tissue repair and recovery. And this gives added resilience. When we look at the three of these together, they work very brilliantly to support the mental bandwidth, which, as we know with tesofensine, is going to lower the food noise. In fact, the noise all around, simply because of the ability to compartmentalize thinking. And I think one of the most fascinating things that I'm hearing over and over again is that I'm so alert and so on, but I'm also calm.
When your neurotransmitters are optimized, you are going to just feel like you're in flow state where you're thinking more clearly, you're able to learn things easier, you're not getting so distracted. Not only just the loss of food noise, but you're also just able to focus because you don't have all the other distracting thoughts. If your anxiety is lowered, you're not going to have that kind of obsessive compulsive thinking, better motivated, you have more energy because norepinephrine's going up. You're also going to be able to think better. And then, of course, with the dopamine, better motivation as well there. Because of the long half-life, even if you take it every other day, you're still going to see results. You're going to see benefits. Those of you out there who might be on a medication, an antidepressant, something for anxiety that could already be affecting your neurotransmitters, if you're a little worried about how Elevate is going to interact with that, I say the best thing to do would be to consider every other day. Even in some people who are very sensitive to medication, you could even go every 3 days and just see how you do. It's going to minimize your side effects, and you can do that for a week or two. And then as you feel more comfortable, as you feel more used to the medication, you can then go from every third day, every second day, and then every single day. But for those people who are really gung ho and they want to just take it every single day because they feel great, that's fine too. I mean,
Have at it. Have at it. We actually even have a handful of people that are taking two a day. So it is just individual. It's finding your own rhythm. There are some of these things that are just simply in that adaptation phase that will, for most everyone, pass. Learning how your body specifically is responding to this product. I want to normalize it. I don't want people freaking out, thinking, oh no, there's something wrong with me. And if at any point it feels really like, listen to your body, right? If it feels like just too much, take it every other day. But the recommended cycling is 2 months on for Elevate, just like body, and then 1 month off. And I think that you could already discuss why that's so important. Anything else you want to add about the importance of cycling?
I know everyone's so excited about Elevate. They're hearing the frenzy of people talking about it. They're so excited. They want to try it. And a lot of people who are new to Nueva, who've never tried any of the peptides, they want to try Elevate. But I think it's important to really understand which stacked peptide product would be best for you to start off with. Okay. So when I'm talking to my own patients about the three different products that are available, beauty pretty much is non-negotiable.
Yeah.
If you are, in your 40s, 50s, we all can tell. I mean, once you get into your 40s, that's when everyone starts to have tennis elbow, golfer's elbow, your shoulder goes out of whack, the rotator cuff tendonitis. We start to see wrinkles. We start to see bruising. You just hit your arm a little bit and you get a bruise. So you're basically breaking down faster than you can heal yourself. And that's where the beauty peptide comes into play. So every one of us can benefit from taking that on a day-to-day basis. The other two, the body peptide, the Elevate peptide, that's where you really need to get clear on which one would benefit you the most. If you think about body, that's going to upregulate your mitochondrial function. And mitochondria, once you get to be in your 70s, you really only have 30% of your mitochondria left. So anyone coming to see me who's talking about fatigue, difficulty losing weight, if they're 70 and older, I just say you need to go on the body peptide, because it's just like dealing with somebody who has a flip phone and you're trying to do all the work on a flip phone. It's never going to get done. You need to upgrade from a flip phone to a smartphone. Age is something where it's really easy to say, okay, you're at a certain age, you need to just start with body first. Because if you try to upgrade your flip phone with the newest operating system, if you try to add, all the different apps on a flip phone or an iPhone 5, it's just not going to work. And so upgrade your hardware first with a body peptide. How I like to think about the Elevate is that's where you're upgrading your operating system. So if you have, the newest phone and you're adding in all the apps and you're adding in a new operating system, it allows the apps to be able to work together, connect with each other. It runs more smoothly. You're not going to get so many crashes. So that's what Elevate Peptide is doing for you. Personally, I still have my iPhone 11 and it still works. It just takes a little bit longer for things to, get started. It runs out of battery so much faster than everyone else. It just seems like it doesn't charge as fast. And so that kind of gives you an idea of, do you need to upgrade your hardware, or are you someone who can go right ahead into Elevate and
Upgrade your operating system. I
start?
am so glad that you're saying this because I know a lot of what people focus on is the weight loss. And with Nueva Body, it was kind of a mixed bag because it's working with the metabolic and energetic pathways. And if yours needed upgrading, that was going to happen first. And in fact, some people even put on some pounds. Your body is not going to let go of those extra pounds, that water, until it is fully optimized. And so along comes Elevate, and people are just so excited because it appears that the weight is coming off so much more easily. It all rises and falls around a healthy mitochondria. And when you're boosting your levels of NAD, when you're supporting insulin sensitivity, you're right at the roots of everything that matters, not to mention the sloop, which does tell your muscles you're exercising even when you're not. So, body mass index. Don't get so excited about the new shiny object that you forget about the benefits of body.
And it's also important when you're talking to people, just asking them about their diet and to let them know you should be moving, you should be eating enough protein so you can build muscle. No matter what you're doing, if you're on the body peptide, the Elevate peptide, you want to make sure that you're getting an adequate amount of protein. It also is very helpful to move, especially if you're older, adding in resistance training, trying to build muscle because you're upregulating your mitochondrial function that way too. So you're getting the best of both worlds, what your body's doing, and then also the peptides, what it's doing as well. For people out there taking Elevate, listen to your body,
Yes.
sit down, maybe keep a journal of how you're feeling. And when people ask about, how much weight should I expect to lose, just based on clinical studies, it's going to be with one tablet, one Elevate tablet. Typically, you can tell people about 5 to 6%. If you were to go up to two tablets, you're going to look at maybe 10 to 11% weight loss. And so people can definitely lose less or lose more, but that is something that typically you might see. And then the other thing that they found with the research is that it's primarily more fat loss rather than muscle loss. It's maybe more beneficial than an injectable peptide, where we worry more about losing muscle than fat, primarily more with semaglutide, which is Ozempic, Wegovy, with Zepbound, Mounjaro, tirzepatide. I don't see as much muscle loss with that injectable peptide. With the tesofensine, that's what it showed, was more fat loss rather than muscle loss. So that is something that you can tell your clients, your customers, if someone voices concerns about losing muscle.